All right, in this training, we're going to talk about how to start an IV therapy business as an RN without all the confusion in under 7 minutes with bonuses. So right off the bat, the first thing I'm going to do is share my screen. I want to keep this very simple, easy to understand. Pop this up real fast. Hope you're all having a great day out there. Okay, so how to start your IV therapy business as an RN without all the confusion. So let's scroll right through this. First thing is a medical director. Now, I'm going to throw one little asterisk in there. Depending on the state you're in, there's a few factors that are going to be different. Today we're talking about, in general, if you're in a state that is a corporate practice of medicine state or non-corporate practice of medicine state, this is typically how it needs to be set up. There's few caveats on, it's like some states you have to be an MP and you don't have to have a medical director. Some states you might have to have money flow through the doctor. So we're going to touch on a little bit of that, but most of this is just about the general how to set it up. So medical director is going to need to be who states what you can and can't do under their license. They're your supervising physician. Pretty much all states you need that. Again, some states, nurse practitioners, you don't. MD contracts, your medical director contract. This is going to state what you can and can't do under the doctor's license. NPs need prescriptive authority agreement as well. Now, an MSO or an MSA contract, management service agreement or management service organization. What this means in these states, typically the doctor can be the only one that owns the medical facility. So you have to have proper documentation so that you can legally get paid. Essentially, that's all that does. An MSA states how you can legally get paid. And to take that a step further, most of these corporate practice of medicine states, you have to have the money flow through the doctor. There's multiple ways to do that. It's not that hard, but that's what that means. Texas is a corporate practice of medicine state. Money's got to flow through the doctor. Florida is not a corporate practice of medicine state. The money does not have to flow through the doctor. So state to state, that could be a little bit different. You're going to need a point of sale system because how else are you going to get money from your clients? Okay, so that's important. Practice insurance policy. You need this to cover you doing your services. We at On Demand Wellness, we recommend the $3 million and $1 million as your limits, and also to add your doctor as additional insured on that policy. All right. Now, you definitely are going to have to get set up with pharmacies, aesthetic companies. If you have gone and done training in aesthetics, your inventory companies, you hopefully want to have somebody you go with that gets you discounts on those, because going straight to those companies, they're going to start you at top tier pricing. Sign protocols by your medical director. This is very important. All your IVs, your injections, all of your, if you do GLP-1s, if you do peptides, all these different things, you need to have signed protocols, preferably each year they're signed, so that you are doing things that the doctor knows you're doing underneath his license, and he's telling you exactly how to do those things. An EMR. So you need something that is HIPAA compliant to store charting in, where you can do all your charting, your consent forms, all those things. Moving on. Good faith exams. This is a big one. Gone are the days where nurses could just work off standing protocols. Like there's maybe one or two states that you can still get away with it for now. Majority of states, the safe way to do it, especially as an RN, get a company that does your good faith exams. And we have ones that we recommend. There's tons of them out there where they will do your approvals or your good faith exam for a fee. And then now you have a clearance typically for a year. Some services may be a little bit less, like GLP-1s, so that they're cleared. That is huge for compliance. Medical support. You need to have a way to get your medical questions answered in a timely manner, whether you have questions about protocols, a client, that. So remember, whatever program you go with, you're going to need to be able to have some medical support. Another big thing we always recommend, make sure you look at your city requirements. Call the health department, call the city, whether you're going to go mobile or you're going to have a location, see any specific requirements they have. If you're going more into the med spa side, for example, if you're in Texas, like I am, you need to look at the TDLR, Texas Department of Licensing Registration. I think that's what it is. So look at your local state requirements on what they have, and it's pretty simple most of the time. And so if there's anything you need inside your location, you also are going to want to have some type of form put up in your location that has your doctor's information. Typically, you really want to have it on your marketing as well, but at least up in your location so somebody wanted to complain, they know who your medical director is, the phone number to hit the board is on there as well. All right, a couple consideration things that are going to be different state to state. Okay, compounding requirements. Some states don't allow RNs to mix or nurse practitioners to mix. All right, so that's a big one you got to know about your state. Sometimes you have to get the pharmacy to mix for you. Some states require, depending on the services, a doctor to be on site or a nurse practitioner on site, or a distance requirement, like how close does your doctor have to be to your site. Telehealth requirements. Some of them allow it to be on a phone, right, where they can see pictures. Some of them, they don't have to be on a phone. Some of them, they have to be in person. So you got to know your state requirements there. And then doctor license requirement. The big one I'll say is Florida with aesthetics. Your doctor typically has to be a derm, a plastics doctor, and they do have to have a distance requirement there. All right, here's some bonuses. So what I just went through was, for the most part, what you need to get set up from the medical compliance side. A couple things on if you're going mobile, IV poles, socks, blood pressure cuffs. I recommend an iPad. It's a lot easier for your clients when you're handing them something to fill out their charting, that they can see it better versus a small phone like this. And then next, mini fridge at your house, right? Because you want to store the vitamins that need to be cold, separate from any food items for safety. Secure your supplies. All your supplies really needs to be somewhere it can be locked and secured, either a room or a cabinet, to prevent anything happening to it. A backpack or some type of a case to transport these items safely when you're taking them place to place. Pelican cases are great if you're going to carry a lot of supplies. And of course, marketing material. You're going to want marketing material, pamphlets, menus, and things like that to hand out. Now, some things that would be really beneficial, and this is things that we offer at On Demand Wellness, but training, vitamin education, weekly business coaching. We use a Telegram group for all of our nurses to be in for medical questions, tons of marketing Canva templates, and a supportive nurse community, which we have a huge supportive nurse community. Lastly, some things you really want to think about when it comes to marketing and advertising. Again, this is a quick overview. Social media is very important. Business connections, local events, the area you're going to serve, getting involved, your website, Google My Business profile. Of course, paid advertising would kind of be another good one down the road as you get more established. Just to kind of do a quick recap, hopefully I got it under 7 minutes. We'll see here in just a second. Medical director, your MD contract, prescriptive authority if you're an NP, your MSO or MSA contract. This is really important. Corporate practice of medicine states especially. The money flowing through the doctor, your point of sale system, malpractice insurance policy covering you and any staff that you have. Adding your doctor's additional insured is important. Having pharmacy and aesthetic accounts, making sure they're legit 503A or 503B accounts. Sign protocols by your medical director, very important, as well as any procedures that he has for you. A HIPAA-compliant EMR. Make sure you're doing good faith exams to get your clients cleared for services. Make sure you have medical support. Check your city for any requirements. I hope this helped. If you have questions, please reach out. Hit me up on Facebook. You can also hit me up at brandon@premieriv.com. Obviously in the group here, you can ask questions. Love to chat with you. I hope you all have a great day and look forward to talking with you soon. Let's see. We were at 8 minutes, 18 seconds. I was close. Everybody have a great day.